With kids, it's amazing how varied their response can be when they first find out that they have cancer and when they're going through chemotherapy. Some of them will become a little removed, and what they need from me is to give them space and to just be a presence rather than trying to force a conversation. And there's others that are going through it and you would never know that they're, other than their bald head, that they're getting chemotherapy, and they just want to play and they just want you to sit down and joke with them. And then, you know, it also changes from when you have a 5-year-old versus a 15-year-old versus a 20-year-old. Every phase, people need different things. And so it's all about figuring out what do they need on this day, what can I give them, and trying to meet their needs. Pediatric cancer can be anywhere from neonatal, meaning you're born with it, every phase of life through, you know, teens, even into young adult period. At Siteman Kids at St. Louis Children's, we'll even see some young adults in their early 20s with different cancers. And the reason for that is because a lot of the cancers that people can have in their early 20s actually behave a lot more like the cancers that kids get. And so the treatments that we can offer to kids are the same treatments that we can offer to these young adults. We also have a clinic where we take care of adolescents and young adults, and that is both staffed and taken care of by pediatricians as well as adult physicians who really help to manage that transition from being a kid to being an adult. Whenever I meet a family, I always make 2 promises to them. One is I'm going to be here no matter what you need, and number 2 is I'm never going to lie to you. I'm never going to sugarcoat things, but I'm going to help you get whatever information, whatever guidance you need. And that becomes the bedrock for that relationship. And the most exciting days are the days when patients finish their treatments. We have a bell ringing ceremony. I get to give them their diploma, give them a hug, meet the whole family, extended family, you know, people coming from miles and miles away to be part of the celebration. It is just one of the most joyful days you can imagine at the end of a clinic day. Cancer has always been a really loaded word in our society, and it used to be, it was so scary people wouldn't even talk about it. And it used to be cancer means death. It means you're not gonna make it. And now we're at a place where not only are people making it more and more and more and doing really well, we even have sometimes a single medicine that can keep your cancer at bay for a long time. And we're still at the forefront of all of that we're gonna learn. Eventually, we're gonna get to the point where cancer is manageable, where we don't have cancers that are really hard to treat, where we are able to give people both a good quality of life and a long life. So Siteman Kids at St. Louis Children's stands out because it is the cutting edge of treatment technology, of diagnosis technology, but also the cutting edge of all types of research that are aimed at making people's lives better. You know, we've got clinical trials, we've got basic science research. Then we've got research like mine, which focuses on how do we make sure your quality of life is as good as it can be? How do we make sure you're getting all of the resources, all of the healthcare access that you need? That full picture of the patient is also the full picture of our research, where we want to improve everything from diagnosis to every day of your life. A lot of my research actually focuses on how we communicate with families and how we understand both what the kids need, but also what the parents need and what the siblings need. And through all of that, we've learned is that parents need some time on their own so that we can sit with them, let them vent, let them tell us what they need to know. And parents often need a little bit of space to process things before they're around their kids so they can feel like they're being strong. What we try to do is not force anything onto any particular family, but figure out how that family works. How do we communicate? How do we provide care in a way that kind of meets the way that their structure, their family works? And so tailoring that communication strategy is really important. I've had some families where they'll say, I really need to talk to you in a separate room so that I can cry because I can't cry in front of my kid and I need to be strong. I've had other families who say, we are a unit. I don't want to hear anything outside the room that's not said in the room, and we adapt. Our goal is not to communicate in the way we want to. It's to communicate in the way that the family wants and what the family needs. And also to adapt that over time if their needs change. I have to say, every day I wake up, I am excited to come to work. Whether it's seeing patients, whether it's doing research, it is an immense privilege to be happy and fulfilled, even though I'm exhausted at the end of the day, knowing that I put it all in the field for something that really matters.